So today we are going to do a very unique thing. Okay. So what happens is that you read a lot many things about the nerves. Okay. What which nerve has which what root value, and what is it supplying, what is the content of the femoral femoral canal, okay, or your adductor canal, which nerves are going through it. You may get confused, okay, of the lower limb, especially of the lower limb, few nerves of the abdomen and pelvis also, okay. You get confused of how they're arising and what is their exact course, okay. And you get confused how it is related to your lumbar plexus or how it is related to your sacral plexus and all, okay. So you get confused and mug up a lot of things, okay. So today what we are gonna do is that we will see the nerves from their exact branch points, okay, from the lumbar plexus, how they are originating, how the femoral nerve is originating, what are the muscles it is supplying, in what canal it is entering, and what are in which nerve is entering what canal, obturator nerve, about what divisions it has, anterior division, posterior division, and how it is supplying the knee joint, okay, and what muscles it is supplying. Then we'll take the popliteal your popliteal fossa and see tibial nerve and common peroneal nerve, about all their branches, okay. uh, and other things about your sacral plexus, the nerve arising from sacral plexus, okay, which are forming a superior gluteal nerve, inferior gluteal nerve, how they are formed, what is the root values, all of them, okay, all of them, literally all of them. So we'll discuss the nerves which are present in your lower part of body, and what nerves arise from which places, we will get to know from this, okay. So let's draw from your L1 level, L1, L2, L3, L4, L5, okay, and your S1, then S1, S2, S3, okay, and your S4. So in this video we will cover your lumbar plexus as well as your sacral plexus also, okay, understood? So let's start, okay. Talking about the lumbar plexus, okay, let's first start from the lumbar plexus. So first branch starting from your L1, okay, so this is the nerve starting from the L1, okay, and it is giving up two branches, your ilio hypoglossal nerve, okay, and your ilio inguinal nerve, your iliohypoglossal nerve and your ilioinguinal nerve. Just remember that the ilioinguinal nerve, okay, is a content of your inguinal canal, the content of your inguinal canal, understood? So this is the L1 level first, okay. So from L1, what two nerves one branch is arising, okay, which is giving two other branches, iliohypoglossal and your ilioinguinal nerve, okay. Combinedly from your L1 and L2, okay, from your L1 and L2 a nerve arise which is called as your genitofemoral nerve, okay. So it gives your genitofemoral nerve, and genitofemoral nerve will have the root values L1 and L2, okay. And just remember that the femoral branch, it has a femoral branch of genitofemoral nerve, okay. It has a femoral branch of genitofemoral nerve, and it is the content of your femoral sheath and the femoral canal, okay. So if you take the femoral canal here, so it is the content of this, understood? It is present in the first component, okay. So femoral branch of your genitofemoral nerve passes through your femoral canal, okay. This is your femoral canal, okay, understood? Then what nerve we have, okay. Starting from your L1 and L2 is done. Starting from your L2, L3 and L4, you get a nerve which is your femoral nerve, okay. From L2, L3 and L4 you get one of the main nerves which is supplying the anterior compartment of your thigh, okay. It is your femoral nerve. So let me draw the This is the femoral nerve coming over here. Okay, this is the femoral nerve. It's the femoral nerve. Okay. Okay. It starts from a L2, L3 and L4 levels. Okay. So femoral nerve, another thing which I want to remark, okay, another thing which I want to remark, let's take it, this one. Okay, we have something like this. Something like this. Okay, can you identify what is this? It is the femoral canal. So the femoral nerve passes, okay, the femoral nerve passes inside the femoral canal. Okay, the femoral nerve passes inside the femoral canal. So it is the content of your femoral canal. Just make a correction that this is not a femoral canal, it is a femoral sheath. Okay, it is the femoral sheath, femoral canal. It passes deep to a femoral canal. Okay, and another content of your femoral canal is the lateral cutaneous nerve of thigh. Okay, so arising from the L2 and L3 parts, L2 and L3. Okay, from this branch, okay, another nerve is there which is called as your lateral cutaneous nerve of thigh. So this is your lateral cutaneous nerve of thigh. What is the root value? The root value will be L2 and L3. Understood? L2 and L3. So it is a component of your femoral, not the femoral nerve. It is supplying the lateral aspect of your skin of your thigh. Okay, as the cutaneous nerve. Okay, and this lateral cutaneous nerve of thigh, if it is compressed in within the inguinal ligament, okay, if it is compressed, the compression will lead to a disorder called as your meralgia paresthetica. Okay, so this is a lateral cutaneous nerve of thigh. Understood? And this one is the femoral nerve going through the femoral canal. Okay, femoral canal. What is the root? What will be the root value of femoral nerve? It will be L2 to L4. L2 to L4. Okay, let's discuss about the course of femoral nerve now. Okay, so femoral nerve, just remember that if I am drawing it in black, it means the dorsal division. Okay, dorsal, this all are formed by the dorsal division of the ventral primary rami. Okay, so let's discuss the course of femoral nerve in your thigh and your leg region. Okay, so let's say here we have the inguinal ligament here attached to the big tubercle. Okay, so inguinal ligament here, and let's say here is your thigh. Okay, here is your thigh. Okay, so if here is your thigh, so the femoral nerve will go like this. Okay, and will go like this. Okay, before it passes deep to the inguinal ligament, okay, it will give three branches. The trunk of the femoral nerve will give the branch to a muscle which is called as a iliacus. This one is a iliacus. Okay, another branch is to the pectoralis, is to the psoas major. Okay, not the pectoralis, the psoas major. Psoas major, and another branch is to your pectineus. Okay, let's draw the pectineus like this. Okay, another branch, the trunk only, it supplies to your pectineus. Okay, it gives three branches here. Okay, understood? It gives three branches here. Then it goes down. Okay, it goes down and divides into, at the level of lateral circumflex femoral artery, LCFA. LCFA is a lateral circumflex femoral artery. Okay, it divides into two branches, which is your anterior division, okay, and your posterior division. Okay, let's discuss about this anterior and posterior divisions. So anterior division will first give a branch to a sartorius muscle present over here. So this is the sartorius, okay, sartorius. And again it will give a branch, again it will continue and form the ICNT and your MCNT. Okay, what are ICNT and MCNT? So ICNT is your internal cutaneous nerve of thigh, okay, and MCNT is your medial cutaneous nerve of thigh. And you saw that we had a lateral cutaneous nerve of thigh also, okay, which was going through the femoral canal. Understood? So this is the whole that pathway of the anterior division. And of the posterior division, the posterior division will give four branches to the anterior muscles, that is one to the rectus femoris, one branch to the vastus lateralis, one to the vastus medialis, and another one to the vastus intermedius. Okay, vastus intermedius. Understood? And after this, at this level, okay, it continues at the saphenous nerve. Okay, and supplies the anterior aspect up to your grade 2. Okay, it becomes the saphenous nerve. And this saphenous, why it is called? Because at this level it runs with the saphenous vein. Okay, it runs with the saphenous vein. Okay, just importantly remember that the saphenous nerve is the content of your adductor canal also. Okay, the saphenous nerve also goes through your adductor canal, okay, your Hunter's canal. Okay, so let's say you have the adductor canal here. Okay, saphenous nerve is present over here, but I'm drawing the adductor canal separately. Okay, so saphenous nerve passes through it. So I'm relating it with your theory part, okay, because it is a revision session. Saphenous nerve and a nerve to the vastus medius, nerve to your vastus medialis or your vastus medius, it also goes through your adductor canal. Okay, and another nerve we'll see in a while, the genicular branch of the obturator nerve. Okay, we'll see. Understood? So this is your femoral nerve. And it is running through these parts. Okay, then let's discuss about the obturator nerve. So obturator nerve rises from the ventral division. Okay, it rises from the ventral division. Understood? So L2, L3 and L4, but the ventral division now. L2, L3 and L4, but which division now? It is the ventral division. So this is the obturator. Nerve, okay, which rises from the ventral division. So I'm drawing it with blue. Okay, so root value is same, L2 to L4. Ventral division of the ventral primary rami of L2, L3 and L4 segments. Okay, this is the obturator nerve. So what is the course of obturator nerve? Okay, so obturator nerve at the level of your obturator foramen, okay, it divides into two parts, your anterior division and your posterior division again. Okay, okay, so now we will see which aspect of your obturator nerve supplies the medial aspect of your thigh. Okay, so we are seeing the your thigh from the sagittal section. Okay, we are seeing from the side. Okay, just imagine we are seeing from the side. Okay, so let's draw like this, a little bit narrower. Okay, this is a anterior division, this is a sorry, not ventral, this is a posterior division of obturator nerve. Okay, so the anterior division, first of all, okay, it will give a branch to your pectineus. Okay, it will also give a branch to your pectineus. Okay, so pectineus is a hybrid muscle because it is supplied by the femoral nerve as well as the anterior division of the obturator nerve. Okay, then it gives a branch to your adductor longus. It gives a branch to your this muscle over here, is called as your adductor longus. Okay, the adductor longus. Then it again gives a branch to a muscle which is called as your adductor brevis. Okay, adductor brevis. Okay, and it again gives a branch to a muscle which is called as your gracilis. Here's a muscle called as your gracilis. I'm just drawing the muscle, just schematic diagram, so don't mind which region I am drawing. Okay, for exact regions you can just look at the atlas images. Okay, and this posterior division, it first pierces the obturator internus muscle. This is the obturator internus muscle. Okay, and it goes down and pierces your adductor magnus. Okay, it pierces your adductor magnus, not the adductor magnus. It pierces it comes via the adductor hiatus. Okay, we have an opening here which is called as the adductor hiatus. Okay, and this adductor hiatus is present in your adductor magnus muscle. Okay, it is present in the adductor magnus muscle, so it pierces and comes out like this. Okay, and this nerve which comes out is called as your genicular branch, of your obturator nerve. Okay, genicular branch of your obturator nerve, which gives innervation to the knee joint. Okay, just importantly remember. Okay, let's write the knee joint later. Okay, just importantly remember that this genicular branch of the obturator nerve also is the content of your adductor canal. Okay, so genicular branch of obturator nerve is also the content of your adductor canal or your Hunter's canal. This is your adductor canal, or your Hunter's canal. Okay, so now can you trace the nerves? Okay, so we completed our femoral nerve as well as the obturator nerve here. Okay, with relation to your lumbar plexus. Okay, now we have to discuss another important nerve, which is your sciatic nerve. Okay, another thing which I want to remark, there is an accessory obturator nerve arising from the L3 and L4 divisions. Okay, we have an arising from the L3 and L4, we have an accessory obturator nerve. Okay, accessory obturator nerve, which will also supply to the pectineus. Okay, this one is an accessory obturator nerve. Okay, and it goes in front of your superior ramus of your pubic bone. Okay, in front of the superior ramus of the pubic bone. This accessory obturator nerve, it is optional. Okay, not always present. Understood? Afterwards, after the obturator nerve, okay, we discuss the obturator nerve. Afterwards, let's discuss the nerves that are arising from the sacral plexus. Okay, lumbar plexus, lumbar plexus is up to the L5 level. After L5, we have the contribution to sacral nerves. Okay, so sacral plexus is also formed. Okay, sacral plexus is formed. Okay, so first of all, let's start with your superior gluteal nerve. So arising from the dorsal division. Okay, the dorsal division from the L4, L5 and L6. From the L4, L5, sorry, not the L6, sorry, S1. No, there is no L6. Okay, so arising from this is your nerve which is called as your superior gluteal nerve. Okay, superior gluteal nerve, it is again the dorsal division, because I am drawing the dorsal division in black. Okay, and the ventral division in blue. Okay, so it is the superior gluteal nerve having the root value L4, L5 and your S1. Okay, superior gluteal nerve, and superior gluteal nerve supplies three muscles. Just remember, it supplies the tensor fascia lata muscle. Okay, tensor fascia lata. Okay, and it again supplies your gamulus gamulus medius, okay, and your gamulus internus, okay. Sorry, what I am saying, okay, this is not the gamulus, okay, this is the gluteus medius and gluteus internus, okay, this is a gluteus minimus and your gluteus internus, okay, gluteus minimus and your gluteus internus. So let's take this diagram to a little bit of left so that we can get some more space to draw. I'm drawing it in such, okay, let's move it a little bit like this, okay, understood. So superior gluteal nerves, and you must have read that the piriformis muscle, there is a muscle called as a piriformis, okay, like this, it's shaped like this, piriformis muscle, okay, and from above the piriformis there is the origin of your you can see the superior gluteal nerve and vessels, okay, and below the piriformis you will observe the arising of inferior gluteal nerve and vessels, okay. So this is the thing, okay. Let's draw the vessels also. This is the superior gluteal vein, this is the inferior gluteal vein, and about the arteries, here is our superior gluteal artery and inferior gluteal artery, okay, and the piriformis is the landmark muscle which is dividing them both. This is the landmark, okay, which is separating them both, okay, and the superior gluteal nerve and vessels is the content of your greater sciatic foramen, okay, greater sciatic foramen, and this is the content of your lesser sciatic foramen, understood. So after the superior gluteal nerve, let's discuss the inferior gluteal nerve, okay, which arises from a L5, S1 and S2. So arises from a L5, S1 and S2, okay. This is your inferior gluteal nerve. Let's take this to this part, okay. This is your inferior gluteal nerve. This is your inferior gluteal nerve arising from your L5, S1 and S2, L5, S1 and S2, okay. And inferior gluteal nerve supplies your gluteus maximus, okay. It is also your dorsal division, okay, understood. Afterwards there is a nerve from the dorsal division only, okay, which is called as a posterior cutaneous nerve of your thigh, okay, from starting from the S1, S2 and S3. Let's maintain the color coding, S1, S2 and S3, okay. There is a nerve which is supplying the posterior aspect of the thigh, okay, the skin of the thigh, posterior cutaneous nerve of thigh, okay, posterior cutaneous nerve of thigh, understood. And again from S2, S3 and S4 we have the pudendal nerve. S2, S3 and the S4 we have the nerve which is called as your, so the root value of posterior cutaneous nerve of thigh, it is your S1, S2 and S3, okay. It is from S1, S2 and S3. In the S2, S3 and S4 we have the pudendal nerve. Let's write here, not here, the pudendal nerve, okay, pudendal nerve which has root value of S2 to S4. Let's discuss the course of the pudendal nerve now, okay. So talking about pudendal nerve, this pudendal nerve moves through the pudendal canal, okay. Here we have a canal. Let's draw it straight, otherwise we'll not be able to show the branches clearly, okay. It moves via the pudendal canal, okay. Here is our pudendal canal. pudendal canal. Okay, so in pudendal canal, the pudendal nerve comes, okay, and it continues at the dorsal nerve of penis, okay, and again it gives two branches, your inferior rectal nerve, okay, and a perineal branch, which continues like this. This is your perineal branch of your pudendal nerve. This perineal branch will also give a branch outside the pudendal canal, okay, which is called as your posterior scrotal or your labial nerve, okay, and few muscular branches also. These are your muscular branches. Understood? So this comprises of your, and this is the course of your pudendal nerve. Okay, this is the course of your pudendal nerve. Also just remember that pudendal nerve also gives a parasympathetic supply, a parasympathetic stimulation to the bladder, okay, also gives the parasympathetic stimulation to the bladder, to the external. You have two that sphincters there now, okay, in the bladder. So it gives parasympathetic stimulation to the external urethral sphincter also, okay. It gives parasympathetic stimulation to the external iliac sphincter, causing the sphincter to contract, okay. And if the external sphincter contracts, no parasympathetic stimulation is there, okay, so it will relax, okay. Internal urethral sphincter is not under our voluntary control, but the external is under our voluntary control. Parasympathetic stimulation will cause it to relax, okay. It will cause the sphincter to relax. Understood? So this is about your pudendal nerve. Okay, now let's discuss about the other nerves, okay. Let's discuss about the other nerves. So we have another nerve which is called as a nerve to piriformis, okay. So here was our piriformis muscle. Just look at this. Here is our piriformis muscle, okay. So there is a nerve to piriformis starting from the S1 and S2 regions, starting from the S1 and your S2, okay. There is a nerve to the piriformis, okay. This is called as a nerve to piriformis. So nerve to piriformis, the root value is S1 to S2, okay. Nerve to piriformis root value is S1 and S2, okay. And this nerve is supplying the piriformis muscle. Okay. Again we have a nerve starting from your L5, S1 and S2, okay. L5, S1 and your S2. Now starting from L5, S1 and S2, okay, which is called as a nerve to obturator internus, okay, which is called as a nerve to obturator internus, which will supply the obturator internus, okay. Obturator internus plus your gamellus superior also supplies your gamellus superior, okay. This is called as a nerve to obturator internus, okay. Nerve to obturator internus, which will supply your, and the root value is L5, S1 and S2, okay. This will supply your obturator internus muscle, okay. It will supply your obturator internus muscle plus your gamellus superior, okay. And from the ventral division, okay, arises another nerve, okay, which is called as your nerve to quadratus femoris, okay. Which is called as the nerve to quadratus femoris. It arises from the ventral division of L4, L5 and S1. There is ventral division of L4, L5 and S1, okay. This nerve, okay, well, this is called as a nerve to quadratus femoris, okay. This is a ventral division, okay, from the L5, L4, L5 and S1, okay, and it supplies your quadratus femoris plus your gamellus inferior muscle. Okay, gemellus inferior. Understood. So this is the course of your some nerves from the sacral plexus. Okay, from the sacral plexus. So let me check if I have made a mistake in any color coding, because I am feeling like if I have made a mistake in some color coding. So let me check it. Okay, so here I can see that I have made a mistake. That is this color in the color coding, not in the root values. Okay. So note that this nerve to obturator internus, this is also of ventral division. Okay, this is also a ventral division. So let me trace it with blue. Okay, let me trace it with, okay. So nerve to obturator internus, this is also ventral division. Okay, and the posterior cutaneous nerve of thigh also, which arises from the S1, S2 and S3. Okay, this is also your ventral division. This is also your ventral division. And again this pudendal nerve also. Okay, so here I had made color coding mistakes. Okay, I was just drawing with the flow, so I couldn't see. So this pudendal nerve also, which arises from S2, S3 and S4, this is also of ventral division. Okay, so the pudendal nerve is also of your dorsal division. Okay, so I hope you understood all this and this all made sense about the nerves. Okay, of this, and we are now talking about a major nerve which we are leaving over. Okay, and this is the last nerve to discuss, that is a huge sciatic nerve, which is supplying the posterior compartment of your leg. Okay, posterior compartment of your thigh, and it runs via the popliteal fossa also. Okay, so the let's talk about your sciatic nerve. Okay, so sciatic nerve has two parts, that is your tibial part and your common peroneal part. So the tibial part of sciatic nerve arises from the ventral division of L4, L5, S1, S2 and L3. S2 and S3. Okay, it arises from L4, L5, S1, S2 and S3. Okay, this form your tibial part. Okay, this form your tibial part of your that nerve. Okay, which nerve? Sciatic nerve. And from the dorsal division of L4, L5, S1 and S2, of the dorsal division from the L4, L5, S1, not the S3, S2, arises another part of your sciatic nerve, that is your common peroneal part. Okay, common peroneal part. So this is our sciatic nerve that is transversing. Okay, this is our sciatic nerve that is traveling, this whole nerve, sciatic nerve. Okay, what are the parts of sciatic nerve? So this part, this blue part, let me write it in blue only. Okay, this arises from the ventral division. Which part is this? It is called as your tibial part. Okay, tibial part. What is the root value of the tibial part? L4 to S3. Okay, and this black part of the sciatic nerve is your common peroneal part. Okay, which arises from the L4 to S2. So it runs. Okay, it runs. Let me draw the sciatic nerve like this. Okay, a little bit thicker. Okay, let us draw the sciatic nerve like this. Okay, this is the sciatic nerve. Okay, it hasn't been divided into this common peroneal part and this part. Okay, at the level of your popliteal fossa, so let's draw the popliteal fossa. So it's a diamond shaped fossa. It is called as your popliteal fossa. It divides into the two parts. That is your let's draw the popliteal fossa a little bit bigger, so that we can draw all the branches also, which it is giving in the popliteal fossa. So I am drawing the popliteal fossa like this. You know the boundaries of popliteal fossa: semimembranosus, semitendinosus. Okay, and the long head, the biceps femoris. Okay, all this, and the gastrocnemius, lateral heads of the gastrocnemius. Okay, so we drew the popliteal fossa here. So this is the popliteal fossa. Okay, this is the popliteal fossa. So what muscles it is supplying? Let us mark it. Okay, so at the level of popliteal fossa, it will divide into your two parts, that is a tibial part. Tibial part will go here like this. This is a tibial part. Okay, I'm writing TP. Okay, let's not write TP. Okay, let us just write tibial part. Okay, this is a tibial part, and your common peroneal part like this. This is your CPP, common peroneal part. Okay, so tibial part and common peroneal part. So tibial part in the popliteal fossa, it is within the popliteal fossa. Okay, it will give innervation to three muscles. One is your plantaris. Okay, then your gastrocnemius and your popliteus. Okay, tibial part. Okay, understood. So you can draw the tibial part in blue as such, because I am maintained the color coding everywhere. Okay, and I drawn the ventral divisions in blue, so you can draw the tibial part in blue like this. Okay, popliteus, and it goes down. Okay, it goes down the leg. Okay, and supplies the muscles of the leg also. Okay, which muscles of the leg? Okay, supplies some muscles of the leg, of the anterior compartment of the leg. Okay, all the dorsiflexors of the leg. Okay, so first of all it will supply another muscle, soleus. Okay, soleus, and again it will supply all the dorsiflexors, the flexor digitorum longus, flexor digitorum longus. It will supply the flexor hallucis longus. Okay, longus, and it will also supply the tibialis posterior. Okay, I made a mistake by saying that it is supplying the anterior compartment, supplying the posterior compartments. Okay, because posterior compartment is a flexor compartment in the case of your leg muscles. Okay, so these muscles, and it runs just posteriorly. Okay, just posteriorly to the flexor retinaculum. Okay, let's say this is a flexor retinaculum of the leg. So retinaculum of the leg. Okay, it runs just posterior to it. Okay, and divides into two more branches. Okay, one is called as a medial plantar nerve, and another one is called as a dorsal plantar. Not the dorsal, lateral plantar nerve. Okay, lateral plantar nerve. Okay, understood. Medial plantar and the lateral plantar nerve. Okay, so what is the course of medial plantar and lateral plantar nerve? The medial plantar nerve, okay, we have the layers in the sole. Okay, in the foot. Okay, it supplies of the first layer. We have two muscles, your abductor hallucis longus and your flexor digitorum brevis. Okay, of the second layer it will supply your L1 lumbrical. Okay, of the third layer it will supply your flexor hallucis brevis muscle. Okay, supply the flexor hallucis brevis muscle. Understood. Okay, and this lateral plantar nerve, this is the dominant nerve of foot. Okay, this is called as a dominant nerve of foot. Okay, it will supply all the rest muscles. Okay, all the muscles that are there, like your adductor digiti minimi. Okay, your abductor digiti minimi. Okay, of the first layer, and of the second layer you have lumbricals, L2, L3, L4 lumbricals, and the flexor digitorum accessorius muscle. Okay, and your adductor hallucis. Okay, your flexor digiti minimi. all the rest muscles. Okay, it supplies all the rest muscles. So it is called as a dominant nerve of foot. Okay, just to know, a clinical to note that if it is compressed here, if the tibial nerve is compressed, if compressed deep to flexor retinaculum, then it will cause your tarsal tunnel syndrome. Okay, so compression of tibial nerve deep to the flexor retinaculum will cause your tarsal tunnel syndrome, as it is analogous to the carpal tunnel syndrome in the hand. Okay, where the median nerve is compressed deep to the flexor retinaculum. Okay, afterwards let's trace the course of your common peroneal part. Okay, the common peroneal nerve, okay. So common peroneal nerve inside the popliteal fossa will give a branch which is called as a lateral sural nerve. Okay, just I left a branch here, that the tibial part also, the tibial nerve also gives a branch, okay, which supplies the posterior side of the skin of the calf, which is called as your sural nerve. Okay, sural nerve, which is called which supplies the posterior side of skin of calf. Okay, posterior side of skin of the calf. Okay, so lateral sural nerve, which is a branch of your common peroneal nerve. Okay, lateral sural nerve is one contribution to it. Okay, then it again gives a branch to a superior tibiofibular joint. Okay, it also gives a branch to your superior tibiofibular joint. And it runs down, it winds around the neck of the fibula. Okay, so superior tibiofibular joint, then it wounds around the neck of the fibula. Okay, here is our fibula, so it wounds around the neck of the fibula. Okay, and divides into two branches. Okay, divides into two branches. One is the deep peroneal nerve. Okay, and another one is your superficial peroneal nerve. Okay, so this is your deep peroneal nerve and this is your superficial peroneal nerve. Let me mark it. It wounds around the neck of fibula. If there is a fracture of the neck of fibula, if the neck of fibula is fractured, okay, the neck of fibula is fractured, then what will occur we will see, because this common peroneal nerve will be cut. So there will be effects on the deep, and the deep peroneal nerve will be damaged, and the superficial peroneal nerve will also be damaged. Okay, so we will see what will the effect if the neck of the fibula is fractured. Okay, so let's trace the deep fibular nerve first. Okay, this is your deep not the deep fibular nerve, your deep peroneal nerve. Okay, this is your deep peroneal nerve. Now what muscles it supplies, let's see. And this one is your superficial peroneal nerve. Okay, so first of all let's start with the deep peroneal nerve. Okay, so deep peroneal nerve will supply the anterior compartment of the foot. Okay, it will first supply your tibialis anterior, okay, it will supply your extensor hallucis longus, then your extensor digitorum longus, and a muscle which is your peroneus tertius. Okay, these are all your dorsiflexors. Okay, your anterior compartment of leg, not the foot, of the leg. Okay, this is supplied by the deep peroneal nerve. Okay, and the superficial peroneal nerve, this is superficial peroneal nerve, so it gives two branches. One is called as one is the branch to the peroneus longus, and another branch it gives to the peroneus tertius. Okay, peroneus longus, okay, peroneus longus, not the tertius, peroneus brevis. Okay, you can write this peroneus brevis. You can write this peroneus. Okay, this peroneus tertius can also be called as the, and this peroneus longus can also be called as the fibularis longus. Okay, fibularis longus, and this can be called as the fibularis brevis. Okay, and these both are the everters of foot. Everters of foot. They evert the foot. Okay, eversion, cause eversion of foot. And these are the dorsiflexors of foot. Okay, so if the common peroneal nerve is injured, okay, there will be no eversion, which will cause an inverted foot, okay, and then there will be no dorsiflexion of foot. There will be no dorsiflexion. Okay, so you will have a plantar flexed foot, which is also called as a foot drop. As you saw, wrist drop was there in the hand, so you will observe the foot drop. Okay, the foot drop. Okay, another branch, if you want to know, then there is the sciatic nerve. I told one thing, course of sciatic nerve, as I left one thing, that this part will also run through your piriformis muscle. Here will be the piriformis muscle. Okay, that will be piercing through it. Okay, the piriformis also. Okay, so here is also your piriformis. So the sciatic nerve passes pierces the piriformis muscle also. The sciatic nerve pierces the piriformis muscle also. Okay, understood? Okay, so after this, another nerve is there in your topic, that is starting from the S2, starting from the S3 and S4. Okay, starting from the S3 and S4, there is a nerve. Okay, which is called as a nerve to coccygeus and levator ani. This is also your ventral division. So S3 and S4, you will have S3 and S4. You will have a nerve which is called as your nerve to coccygeus and your levator ani muscles. Okay, levator ani muscles. You know about coccygeus and levator ani. This is present. This you have read in your pelvis part. Okay, nerve to coccygeus and levator ani, and the root value will be S3 and S4. S3 and S4. Okay. So here we discussed all the nerves of the leg, foot, and the thigh. Okay, the anterior compartment, middle compartment, the posterior compartment, and even the lumbar plexus and the sacral plexus also. Okay, we discussed the lumbar plexus and sacral plexus, how they are running, and we also discussed the course of the nerves and where which canals they are passing through. Okay, and how they are passing through, what are the root values and all. Okay, so here are the complete nerves of your lower limb, abdomen, and pelvis. Okay, I hope all that made sense. Okay, and it took a lot of hard work connecting these all things. Okay, so do like, share, and subscribe, and let's meet together. Let's meet again in other lecture. Thank you and have a nice day.